Are there signs your body shows to tell you you're pushing too hard, even though you don't think you are? What exactly is overexertion, and how can you correctly identify the symptoms of overexertion? Well, stick around till the end of the video to find out all about overexertion and some easy and clever ways to avoid it. Overexertion occurs when you push yourself too hard, which can lead to both physical and mental exhaustion. Some factors for experiencing overexertion include your environment, your job, activities you engage in, and your medical history. There are several causatives for overexertion, some of which are extreme temperatures. In regions where the temperature is extremely hot or very cold, your body works hard to maintain its normal temperature, and this could mean that you'll need more effort to perform basic activities, which can lead to overexertion. If you work or exercise outdoors in regions where the temperature is extremely hot or cold, you may be at risk for overexertion. The second cause of overexertion is repetitive movements. Having repetitive movements on a joint or muscle over time can lead to body strain and exhaustion. Now, what kind of repetitive movements do we mean? They include typing or writing, kicking, hitting, or throwing a ball, using your computer mouse, sewing or knitting, training for sports, playing a musical instrument, and working on an assembly line. The third cause of overexertion is performing an activity, exercise, or workout for so many days in a row without having enough rest or breaks. Also, focusing on a cognitive activity such as long hours of studying for extended periods of time can lead to mental burnout and mental exhaustion. The fourth cause of overexertion is sudden body movements and incorrect technique. Making sudden movements with the wrong technique and performing an activity incorrectly can lead to overexertion. Some examples of sudden movements that can cause overexertion are pushing, pulling, throwing, reaching, twisting, and bending. And some examples of activities that can be done incorrectly are sitting with poor posture or in chairs without back support, lifting things incorrectly, using the wrong form when exercising, using wrong gears or equipment, standing in awkward positions, and not wearing knee pads while kneeling. How can you tell if you're experiencing overexertion? Here are some telltale signs and symptoms. Number 1, pain. Overexertion is commonly accompanied by pain. You may feel a throbbing, pinching, tingling, burning, sharp, or even achy sensation. When this happens, take a break from what you're doing and get some rest. If the pain gets worse, it may be time to speak with your healthcare provider. Number 2, fatigue. Overexertion can also be accompanied by fatigue, which can be physical or mental. Physical fatigue includes persistent soreness, slow recovery after workouts or training, heaviness in the limbs even when doing low-intensity activities, and generally poor physical performance. Mental fatigue includes mood changes, increased anxiety and stress, brain fog, depression, and difficulty concentrating. When experiencing fatigue, avoid working for extended periods of time and engage in healthy habits such as staying hydrated, eating nutritious meals and snacks, doing mild forms of exercise, and getting good sleep. Number 3, injury from overuse. This is another symptom of overexertion, and it can occur from repetitive strain, which usually develops slowly over time. Injuries from overuse include tennis elbow, carpal tunnel syndrome, and hairline fractures. These injuries can be accompanied by weakness in the area, stiffness, numbness, pain, and tingling. If you experience any of these, please speak with your healthcare provider who will come up with a treatment plan for you. Number 4, breathing difficulties. Overexertion can lead to breathing difficulties when performing strenuous physical activities. Reducing the intensity of your physical activities can help combat this. Also, breathe deeply and avoid holding your breath so that your body and brain can get all the oxygen that it needs. Number 5, increased incidence of sickness or injuries. When you experience overexertion, your body finds it difficult to heal when you perform strenuous activities, and this can affect your immune system, which can make you more likely to get sick. Getting a mental or physical break from these strenuous activities can help. Also, eating healthy meals and getting enough sleep can also help your body recover. What are some easy ways to avoid overexertion? For physical exhaustion, always stretch and warm up your muscles before engaging in physical activities. If you stay in the same position for hours on end, take breaks every 30 minutes. Avoid doing too much too soon when exercising. Increase your workout duration, frequency, and intensity slowly over time. Include rest days in your workout routine. Learn proper exercise or physical activity forms and techniques. Lift heavy objects with your legs and not your back. For mental exhaustion, research has shown that exercise is extremely helpful for managing stress and protecting you from stress-related issues. Taking a break such as scheduled vacations, long weekends, or engaging in activities that make you happy can also help alleviate some of that mental exhaustion. Another way to combat mental exhaustion is delegating some of your activities to others to reduce the feeling of being overwhelmed. Experts also suggest that practicing some relaxation techniques, aiming to get up to 7 or 8 hours of sleep every night, and keeping a gratitude journal to remind yourself of all the positive things in your life are great ways for managing mental exhaustion. If you got value from this video, be sure to give it a thumbs up, subscribe to the channel, and hit the notification bell so we can keep bringing you the latest health facts every single week.